Hi, everyone. My name is Sarah Kelly, and I'm a research assistant professor at the University of Illinois College of Medicine in Peoria. Today, I'm going to be talking about a collaborative project where the University of Illinois College of Medicine worked with the Peoria City County Health Department on a project focusing on assessing trends in racial and urban disparities of gun violence across Illinois. So just to start out with some background on gun violence, as you all are probably familiar with, this is a growing concern across the US. Illinois is no exception. Not only is mortality related to gun violence on the rise, but so is morbidity. And this is especially true since the pandemic. In addition to this alarming uptick in morbidity and mortality, it's important to note that gun violence often impacts certain populations disproportionately. In fact, prior research suggests that individuals in disadvantaged and marginalized communities are at highest risk of experiencing gun violence, and this in turn contributes to ongoing inequities that exist among this population. Due to this alarming disparity, additional epidemiologic research on gun violence is warranted. So the main goal of this project was to quantify the trends in morbidity and mortality by race and urbanization status in Illinois. In essence, we wanted to see if the disparities were widening in certain populations, whether it be by race or by urbanization status, where they lived. We hypothesized that there would be a growing disparity of gun violence among marginalized populations, as previous research suggests, but we in particular hypothesized that mid-sized metropolitan cities across Illinois would see this growing trend as well. In order to do this, we use two data sources. For mortality, we use CDC Wonder multiple cause of death files. In particular, we use mortality data from 2015 to 2020 to examine the trend of gun violence by urbanization status and by race. We identified gun violence mortality using ICD-10 codes, in particular W32 through W34, and X93 through X95. Using this data, urbanization was classified using 2013 National Center for Health Statistics Urban-Rural Classification Scheme for counties in Illinois. When we examined rates by urbanization status and by race, we categorized race into two groups, largely due to small numbers of minority populations in smaller urbanization categories. We wanted to be able to depict this trend over time. And given that we know that the Black community historically has higher disparities in relation to gun violence, we wanted to categorize race the following ways: Black compared to the other racial groups. For morbidity, we pulled data from the electronic surveillance system for the early notification system of community-based epidemics, commonly referred to as ESSENCE. The subsyndrome firearm data was queried from 2015 through 2021. We weren't able to assess 2021 trends with mortality rates because CDC Wonder data is lagging a little bit. Rates for both mortality and morbidity were calculated using population estimates from the US Census. And in order to assess trends, and in particular annual change in trends, we identified the annual percent change, or APC, for fatal and non-fatal gun violence using joint point software for all analyses. Overall, our analyses found that gun violence mortality does remain highest among large central metro areas, with a mortality rate more than double that of other urbanization categories, like you can see in the figure. In 2015, gun violence mortality was 9.8 per 100,000, whereas in small metro areas in Illinois, it was as low as 3.4 per 100,000. However, by 2020, we saw the gun violence mortality rate grew to 17.1 per 100,000 for this large central metro area, and it was 5.5 in small metro areas in Illinois. But when you assess mortality rates by race among this urbanization status, you see that there's a large disparity in smaller population sizes. For instance, in large central and large fringe areas in Illinois, Black individuals died at 14 to 20 times the rate of other races, respectively. And you can see this in Table 1. More importantly, we see this racial disparity widen even more among medium and small metro areas, where Black individuals in those communities died at nearly 30 times the rate of other races from gun violence. So these were very alarming findings. Now, when we looked at the change in morbidity rates or firearm injuries from Essence data, we find that overall percent change in firearm injuries from 2015 to 2021 in geographic regions classified as medium metro was much greater than that of large central metro areas, further demonstrating the rapid increase in these areas. In particular, cities in Illinois, such as Champaign, Sangamon, Winnebago, and Peoria, they saw the highest annual percent change between 2015 to 2021 for gun violence. And you can see that in Table 2. Although we know that geographical differences and disparities related to gun violence may not be generalizable to other states with similar population sizes, we know that these are important findings. We also know that we aren't able to ascertain whether certain policies or interventions or measures of community cohesion may be impacting some of these findings related to gun violence. And these would be really important to further study. However, we can clearly see from this project that gun violence is a growing concern, especially among the Black community. Although gun violence remains highest among large central and large fringe areas such as Chicago, the racial disparity in fatal and non-fatal gun injuries in small and medium metro areas is concerning across Illinois. These findings highlight the need for additional health interventions for these communities in order to address this widening disparity that's occurring. So that wraps up what our findings from this project. I'm happy to talk more if anyone has any questions or like to further collaborate on such an effort. Again, my name is Sarah Kelly, and my email address is skelly88@uic.edu. Thank you all so much.